Good morning. This is MS. You have hope. Today we're talking with Dr. Is it Sonja?
It's Sonja.
Sonja Tamburic. She's our only protocol doctor in Canada. And so if you're watching this and you're a Canadian doctor, we ask that you seriously consider this because we need more Canadian doctors. And we're grateful that we do have one. Some countries have no doctors. I'm going to read a short disclaimer here, and then Dr. Sonja, excuse me a second, is going to give us a little background on herself. She's going to share with her observations on the protocol, why she did the protocol, and maybe some things that have impeded the progress of the protocol getting into Canada. All right. This interview is about our own personal experiences while being on the protocol or practicing the protocol and observing it as other patients. I'm sorry, I rewrote this. Other patients are doing the protocol. These are our own personal experiences and observations. We are not recommending your choice of treatment or addressing individual cases. Protocols and methods of treating MS can vary as well as results. And for this reason, we strongly recommend using a licensed medical professional. Again, we're with Dr. Sonja Tamburic. Thank you for being with us today, doctor. And we look forward to hearing how you heard about the protocol and how you started.
Okay, thank you, John, for the invitation and the opportunity to share what I've seen in my practice, especially with my fellow Canadians. I have background, I'm a naturopathic doctor. I also have background in conventional medicine. I studied medicine in Europe, and I also have a degree in psychology. Naturopathic medicine was always love of my life because what I've seen in conventional medicine couldn't answer many of the questions that patients had. So this was a great way of practicing. And so what I'm trying to do is to bridge the two and integrate what each one of them offers in order to help patients. What I find a problem is that there's such a division between two worlds, and there shouldn't be. We are all educated in the same physiology and anatomy. It's just that our understanding of the body and the disease processes takes a different angle. And my goal is always to start from more of a holistic and integrative point. The body is a whole. It's not made of parts. And even if some people think it is, these parts have to, just like in a car, work all together in order to heal. How I was introduced to Dr. Coimbra protocol was through a patient who had MS, and she reached out to me to help her with the protocol. So I started doing it from Dr. Coimbra's notes, and then of course you encounter some obstacles, questions, etc. So I started communicating with Dr. Coimbra, and he invited me to come to Brazil and train with him.
What year was that?
This was 2016, might even be the end of 2015. So I went in June 2016 to get training. So I've been around doing the protocol for a while. I don't just see MS patients. I know this is a MS group. I see all kinds of other autoimmune diseases, and I personally struggled with some autoimmune issues when I was a student. And I remember one of my mentors said, I think that you will focus on autoimmune disease in your practice. And so that's what happened. So this is how the journey started. The problem that I have, that we have in Canada, is that patients are fearful of trying the protocol because they think that their neurologist or their family doctors will refuse care in the future if they say no to drugs or if they say that they're following this protocol. I just want to clarify for everyone, regardless whether it's Canada or US. US is a bit different, and so is the rest of the Europe. The rest of the Europe also has same issues in some parts of Europe. Doctors cannot refuse care because you're not accepting their treatment. Okay, it is your body, it is your choice. You're entitled to refuse or accept what they have to offer. That's just what they have. And you're always entitled to all your blood work and your lab work and your MRIs. You don't have to beg for it. It is your full right to have those documents for yourself.
That's big. That's big. And I didn't know that.
So it is not their private property. You just signed the informed consent form, and they have to share the documents either with another doctor that you're working with or for yourself, right? And with any lab work that's done in Canada, you can always say a name of the doctor that you want the copy to go to, okay? And they usually ask you that at the lab, okay? So doctors, this is all coming from my conversation with doctors who have contacted me when I had requested the lab work for my patients. I actually am able to order lab work for my patients. Unfortunately, the system is set so that if I order it through the same lab, they have to pay for it. Whereas if their medical doctor, GP, or neurologist orders, they don't have to pay. So from our conversation with doctors, it came out that doctors, some of them, not all of them, some are great. Some are restricted by the rules of their college, and they're willing to help and trying their best. Some are fully ignorant, and some think that they're there to be the gatekeeper of the medical community rather than to take care of their patients.
Can I say one thing?
Mm-hmm.
Neurologists typically are trying to help you. They've been trained that this is the way to help you, and that naturally is not the way to help you. So they're not being mean or evil.
No.
I think they're just doing what they've been taught.
They've been, exactly. So most of them, but some GPs, they're afraid of their college repercussions. However, you have to keep in mind, and I know that because I have a lot of friends who are medical doctors as well. And with the diagnosis that one has of MS, entitles that GP, I'm talking about GP, not neurologist necessarily, because most of my patients don't see their neurologist very often. Okay, and some refuse to even go for further follow-ups because they think that they have nothing to offer to them, so they just don't even bother continuing with that care. I'm talking mainly about GPs. If you tell your GP that you're on the protocol, they cannot refuse to do the lab work that is required in order to monitor the safety of that vitamin. Because if you go to your doctor and say, I take high dose, I decided to try high dose of vitamin D, that doctor has responsibility to check your kidney function and all the other basic functions that we are required to check for a patient, right? To see that this patient is okay. So this is your basic responsibility, right? Because you can go and say, okay, I'm taking this benzodiazepine for my anxiety. They have to check the safety. They can't issue too many pills, etc., etc. So whether that was your choice, or if you, whatever vitamin you're taking, or whatever drug you're taking, they have to check. So the fact that they haven't prescribed the drug themselves doesn't mean that they're not responsible for following for your own well-being, right? And the safety of what you're doing on your own.
Let me say one thing, touch on one thing she just said there. Okay, you can get your blood test through your regular doctor, but the results you need to go to your protocol doctor with, because this is not a trained protocol doctor. And they may tell you something like they did me and tell me I was in renal failure. And then I went to my protocol doctor. He didn't even call me back for 2 weeks. And he said, no, you're fine. But because my calcium numbers had gone up, my regular neurologist, regular doctor said, oh, his kidneys are shutting down. He's in renal failure. Where my protocol doctor was like, drop your vitamin D level down a little bit. We'll see what it does. It went right back in range. So it's important to be trained on the protocol.
Exactly.
And listen to your protocol doctor. Go ahead, doctor. Thank you.
Yes, that's right, John. That's a very important point we need to make, because the doctors think when they see the vitamin D results skyrocketing, going into what the lab says in toxicity levels, then they get alarmed and get red flagged. So we oftentimes don't even bother testing vitamin D after the second visit, after we see the patient has responded. There's no point. And in Canada, we have to pay anyway unless the vitamin D has been ordered by a specialist or neurologist in this case. Right, so most of the doctors will turn patients off the protocol because they think that vitamin D is toxic to liver, which makes no sense. As we know, it can only cause hypercalcemia. We haven't, and if you look at the research on PubMed, you cannot find any papers on vitamin D toxicity or liver toxicity. We have never found any of the liver enzymes being elevated while on the protocol. Okay. So one important thing I want to emphasize, as long as patients are following the protocol to the T, meaning not just taking vitamin D, but doing the water, doing the diet, watching the calcium, exercising, and last but not least is working on their mental emotional state.
Yes.
Okay, so those are all equally important. I cannot emphasize enough the importance of exercise. Okay, so this is really a tricky one for majority of MS patients, because those that are progressive and are in a wheelchair are unable to perform these exercises, and they're limited to the number of physiotherapies they can get a week. So there are some very difficult cases, and I'm always searching for ways to help those patients out, especially those that don't have the means or don't have much of help to help them with the exercise, because there are some very difficult patients, as we know. And that's one of the groups that I struggle with, to keep on the protocol, to keep on high doses, because we are really risking the kidneys and osteoporosis, etc., etc. So it's not all nice and easy, but we're working on definitely finding the right dose where it's safe for those kinds of patients with very little exercise. And I always encourage them to use part of the body that does work. Because we're covered, our muscles are covered with fascia, and fascia has the nerve ending, and it transfers information to other parts of the body.
If you can't work your legs, work your pythons,
Yes.
do
yes.
something.
And they can always do cross-body exercises with upper body. However, I did have patients who are secondary progressive who couldn't do even upper body exercise. Their brain worked perfectly well from their neck and up, but the body was totally shut down. So those are very difficult patients, and I don't want to give false promises to anyone. Some of them had to stop high doses of vitamin D. Because as we know with those patients, it's not like they're getting any new lesions, but they're just progressing further, right? Or they've reached a plateau. So that's definitely something that, so for those patients, we cannot promise that vitamin D is the only answer. And I
Right.
just want to emphasize the vitamin D is not always just the only answer. All those other things are equally as important. And Dr. Coimbra emphasizes that all the time.
I often tell people, if you're in a wheelchair, you're probably going to stay in a wheelchair, but your disease is not going to progress.
Exactly.
The protocol is a stoppage. It's not a cure.
Yes.
We haven't found a
Yes.
cure for scar tissue yet.
Yes.
Maybe we will someday.
Maybe. Miracles do happen for some people. So that's an important part of really wanting to do this.
Yes.
And believing that there is a help. Yes. And that you can do it.
Your mindset is very important.
Very important. Patients need to be empowered and not reliant only on a protocol doctor, on the neurologist, on any other doctor. We're here just to guide patients, and this is their own journey. This is their own healing journey, and it's up to them how far they want to take what is offered to them.
There's something that the doctor pointed or touched on, I want to touch on a little bit, and that is pharmaceutical companies and drugs. When I went to the doctor, the drugs were considered 30% effective at slowing your progression, not a stoppage, but a slowing of your progression. That means that 7 out of 10 people, the drugs do nothing for. Let me ask you a question. Do they get their money back? No. Somebody is making money. So we need to wake up and realize that they're not out to make you feel better and do all this good stuff for you. They're out to make money. And that is what they do. Go ahead, doctor. Yes. I'll get off my soapbox.
Unfortunately, I agree with you. So now that we're talking about the drugs, there are some patients that also wonder if they're on a disease-modifying drugs, whether they can start the protocol. So I want to address that too. Yes. What I often do is keep them on their drug if they don't want to stop it, and whether I would invite them to reconsider taking the drug will depend on the intensity of their symptoms and the stage of their disease. So if possible, we would like to have them stop the drug and start with a really high dose of vitamin D. There's some people that we can't do that, and so we keep them on the drug and we start the vitamin D, and once we get the baseline and see how they respond to vitamin D with the drug on, then we can reconsider in the future stopping the drug and increasing the dose to support the patient on this journey so that there's no relapse possible. So in terms of that, yes, I agree with you. Vitamin D, I can say for sure, will stop the progression of the disease. It will erase many lesions. I've never had anyone actually relapse and get new lesions on the protocol or get further damage.
Say that again. She has never had somebody relapse and get lesions. People, you need to understand that this is a stoppage and it doesn't come back. I don't get up every day and think about MS anymore. It's gone. Go ahead, doctor. Sorry, had to up in there.
Yes. Yeah. So it's important to understand that it's not a full cure, but it is in a way a drug, natural drug without side effects that will stop progression while you're working on the underlying issue that may have caused the MS. Okay, and there are many, and they're very different for different patients. Okay, so that's very important. This gives you room to work more holistically on finding the root cause and solving that problem. Okay, so that's very important. We don't know whether there is cure, but there are people out there that call that they've cured their MS, and I believe that that is possible. But like I said before, it just doesn't stop at just taking vitamin D and relying on a one thing that will change this very progressive disease. Okay.
I have one question to ask you, because we're going to have to wrap up here in about 10 minutes. Your number one piece of advice to somebody starting the protocol, what would you say is the number one thing that you would tell somebody starting?
So to be patient and to trust.
When I started, I got 6 months along, and Yar Wanderlust, who's in Mexico and got better on the protocol, sent me this email: patience, patience, patience. And when you run out of patience, go out and find some more. And that,
yes,
so true. It's so true.
As I said, because there's such a big range of MS patients, and their picture, the intensity of the symptoms, the symptom picture, the disease, so that one doesn't apply to all, just like one diet doesn't apply to all. Okay. So with Coimbra protocol, I keep people on a low calcium diet, but we do explore, if they're willing, on exploring the perfect diet for them personally, because it is not same for everybody. Okay, but just in my general practice as well as with the protocol. Okay, so that's a very important point. So I get hooked on to just the diet. Maybe your gut needs to be healed, and so you can eat most of the foods that is healthy. I'm all pro healthy diet, not dieting, not eating just one kind of food or none of that. The nature has given us so much for us to choose from, and what suits our body the best. So just keep that in mind. And I'll just reiterate one more time. There's not one diet that has just cured fully MS. Okay. It's a lot of things all together.
There's a lot of diets out there for MS. Have they worked? I have witnessed them working for a lot of people, but I've witnessed them not working for a lot of people. I'm one of them. I did the diets and I kept progressing, and it was frustrating for me because I felt like I was being lied to. You know, I wanted something to stop this terrible monster. And finally, the protocol did.
Yes. Because as we know, vitamin D is a steroid hormone, so it does act like a drug. But again, I want to say without side effects if you follow the protocol.
If you have more time sometime, I'd love to interview you more. But like I said,
it's my pleasure.
Zoom, I hope they don't
has its limits.
Has its limits now, and so I get this pop up and it says I'm on a clock, and so I'm always like, I don't want to say to the person, "Hey, we got to wrap this up," but that's what happens. I get a pop up.
And I also add one more thing for Canadian patients as well, is to save the time and money, they can always book a short phone call to see if the protocol is the right thing for them. And then we send them the lab work so that when they come for a visit, they have the lab work done. So that saves them time and money as well. Also, they need to develop a relationship with their medical doctors and have them on board. In BC, there are some neurologists that are just aware of the works of vitamin D and the protocol from seeing the patients that have benefited from it, and we need to see more of that. Okay.
Can you don't have to give out phone numbers, but can you tell people where you're located at?
So I'm located in Vancouver, BC in Canada, in pretty much downtown of Vancouver. And the best thing is to email the clinic at vncinfo@shaw.ca, vncinfo@shaw.ca. And our great secretary, she will answer the emails if I can't. That's the safest thing to do. And the clinic is 604-738-2111. So I know people are sending me messages through different social medias. I cannot keep up with that. I'm not, I don't have time. I also have kids. So lots of responsibilities and also need time to do research. So
Yes. People be nice to these doctors. If you're not, I'll come and find you because there's so few of them and they
yes,
are inundated with patients. And so try not to expect every email to be answered because as Dr. Demas said before, if it's important, they'll get back to you. If it's an
yes.
ordinary simple symptom, they may not get back to you because they just don't have time to answer all
And
your.
I'm happy to do like an hour of answering questions for these patients, the little questions that may be the same for everyone, you know, so just bring more clarification so that they don't need to email me all the time. So yeah, yeah, it's very hard to answer emails because our job is not to answer emails. So, and
Right.
we don't want to overwhelm our secretaries either. So, and they can't answer questions. So
Exactly.
only urgent questions, emergencies. And Dr. Coimbra said, what you need to do if you feel like you are experiencing toxicity or hypocalcemia, you need to do the lab work, send it, flag it, and then we will of course answer to that. And because without having those lab work done, it's pretty hard to assess.
Well,
So
doctor, thank you for joining us this morning. And I hope you can join us again. It's so hard to get
yes, it'll
interviewed.
be my pleasure. It's I'm here now,
Love
here to
talking to
stay.
you. And you Canadian people, get on board. You know, it's going to take off here for too long. It's going to be hard to schedule appointments. So get your appointments in and get better. That's what I tell people all the time. Get better. It is possible. All right.
Thank you, John.
All
Thank
right.
you for all the